Hello, and welcome to our COVID-19 update, where we'll be talking to the Minister of Health, the Honorable Dr. Frank Anthony. Hi, Minister, and thank you for joining us today.
Thank you very much for having me on this program.
So let's jump right into it. Last week, the training would have commenced for the antigen test. Can we get an update on how these will be rolled out by the healthcare professionals?
Well, we have started doing a number of training sessions. So the first session was done with the staff of the Georgetown Public Hospital, and we give them the details of how this test works, um, and they went through the theoretical part of the training. And what they'll be doing shortly is to do some of the practical aspects. So basically swabbing someone and then going through the different processes of doing the tests. And once they have successfully complete that, then they're ready to roll out this test in their institutions. So apart from Georgetown Hospital, we also started the training of regional officials, and similarly, theoretical and practical. And once they have completed that, they'll go back into their respective regions and train persons in those regions. So the process is on its way. Most people have completed the theoretical. Some just have a little bit of practical training to do. So I expect by this week, all the institutions should have the antigen test available to them.
And Minister, what would determine if a person gets a antigen test as opposed to a PCR test?
Well, the PCR test is still the gold standard for testing. And we still have that. We still have the capacity to do that. We have increased that capacity, because we've constantly been adding equipment and so forth at the national lab. So over the weekend, for example, we brought in 2 PCR machines and additional reagents, and these are all automated machines. So we would now be able, once we install the machine and put everything together, we will be able to do more than 1,000 PCR tests per day. I would say we can comfortably do about 1,500 or more in a given day. So our capacity has gone up, and PCR would remain the gold standard. However, we have these antigen tests that are much cheaper and quicker to do. And we will be deploying them, but there are conditions for the deployment because they're a little bit less sensitive. So at the beginning of someone getting infected, they're not as effective as to detect the infection. But if you wait a few days, then they become more effective at detecting the infection. So with the antigen tests, our protocol and the WHO protocol suggests that you use them when somebody displays signs or symptoms of COVID-19. So if somebody got a fever, if somebody is complaining of fatigue, headaches, all the typical signs and symptoms of COVID, if they have lack of smell, lack of taste, these are all signs that we will look for. And once people are displaying these signs, we will be able to do the test. Once we do the test, it's a very simple test to be done actually. So just like with a PCR, you have to swab the person. And once you complete that swabbing, you take the swab. There are little tubes that you'll have. You put them in there. There's a special set of reagents in the tube. You twirl it for maybe 3 or 4 times. And then you take droplets from that tube and you put it onto a testing board. And once you put the droplets there, you wait for 15 to 20 minutes, and then you'll see some lines appear, which would indicate whether the person is positive. So once those lines are there, you know the person is positive. So it's very simple, and you can see it as it unfolds. So we thought that it's important to use this, especially in some of the areas where it's challenging to do the swab and then send the swab out to the national lab, that once people display signs and symptoms, they're in a hard to reach area, that these tests becomes more important. So that's why we're deploying them. But we are using it in combination with PCR. So if, for example, we have a negative result, then we can swab that person again and send that swab now to do a PCR test, right? If the thing come back, if the antigen test is positive, that means that person is positive. But if they're negative, it means that probably the test was used too early, so it can't rule out that it wouldn't turn positive in a few days.
And Minister, before we move on, are there any plans to bring in more antigen tests, more than the initial 20,000 that was agreed to?
We have more than 20,000 in country because we have received a substantial donation from ExxonMobil. And so they would be donating a number of these tests to us as well. So in combination with what we've bought and what Exxon is donating, I think we probably have about 50 or 60,000 test kits in country, which is quite a lot.
Okay, thanks for that, Minister. Now turning our attention to St. Cuthbert's Mission, Oriel, and Siberut. I know we would have dealt with the spike there, but Bartica was showing some high numbers over the last week. Can we have an update on that?
So with St. Cuthbert's Mission, we still don't have like zero transmission. There are still a few cases there. We are about 20 or so cases in St. Cuthbert's Mission. In Siparuta and Oriala, we have about 5 cases each, so those are coming down nicely, but we'll have to remain vigilant in all 3 areas. In terms of Bartica, we have seen over the last couple of days a slight increase, and so as of today, we now have 79 cases. We had 62 cases last week. This has gone up now to about 79 cases. So we'll have to continue monitoring. We have to continue enforcing the guidelines up there because there are too many people who are just walking around without masks, not obeying the COVID guidelines. And these things can assist in the spread of the pandemic there. Also, as you know, Bartica is situated in such a way where a lot of persons who are doing mining are transitioning through the community. And if when they're transitioning through the community, if they don't abide by these rules as well, maybe if they're coming from a community where there's some amount of infectiousness, they can easily bring that disease into Bartica. And if they don't protect themselves properly, they can easily spread it. So these are things that are of major concern, especially now that we are in this season of Christmas, that a lot of these small, medium-scale, and even large-scale mines are closing, and many of those persons who would have been on those mining sites are returning home. And that can pose a challenge as people move from these communities and through some of these communities. If they don't wear masks and so forth, they can easily transmit the infection if they're positive. So it's something that we are looking at closely, and the health team in the region, they are looking at a number of options of how to curtail spread with people passing through the community.
So as it is right now, there's no specific protocol for these miners coming out of the interior?
Well, the protocol is that you abide like everybody else with your social distancing, wear your mask, and so forth. And if you're positive, not to travel. You should be isolated. However, as you know, this disease, some people might be asymptomatic, and they themselves don't know that they are carrying the virus, and therefore they can unwittingly expose others to the disease, especially if they're not wearing masks. So that's why it's important that everybody mask up.
And are there any other communities around Bartica that are being monitored?
Well, so far, most of the cases are in Bartica itself, so that's where our focus has been. As you will recall, just a couple of weeks ago, we've had cases in villages surrounding Bartica, and we have been able to deploy medical personnel there and to look at, what is happening there and help those communities. So our challenge right now is not so much with those communities, the surrounding communities, but more in Bartica Central.
Well, wrapping up, Minister, we know that there have been some notable increase in the enforcement and some persons have been charged. And given the fact that we're now entering the Christmas season, do you see the greater need for enforcement?
Well, it's always good if people can abide by rules. However, there are going to be a few rule breakers. We really, the bottom line is around the world, the best way to deal with this pandemic is for people to, keep their distance away from each other and to wear masks and to sanitize. These are three simple measures. Unfortunately, while a number of persons here are compliant, there are still a recalcitrant bunch of people who just go out and they don't care. And their attitude, this cavalier kind of attitude, would endanger a lot of other people. So I understand fully well that it's Christmas time and people generally tend to want to go out and have a good time. But we are not in a regular Christmas season. We're in a pandemic. And in a pandemic, unless you take safety precautions, we are going to see more cases. So if there are people who are going to behave irresponsibly, they are going to put a lot of people at risk. And therefore, to avoid that, that's why the police, the army, and the other enforcement agency have stepped up and are going to step up in the coming weeks, because that is very, very important. If we don't do this, we are going to see an increase in hospitalization after Christmas and going into the new year. And if this is not managed well, it can easily overwhelm our hospital capacity. So we are urging people, this is important. It's really important for all of us, because if we don't do that, then we're going to overwhelm the health system and a lot more people would lose their life. We can avoid all of this if everyone behave responsibly. So I do hope that good sense can prevail and that people start playing their role, start behaving responsibly, because it's incumbent on all of us, if we want to stay safe, that we practice the right things.
Thank you so much, Minister, for that. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or social media platforms.